Well, at the just concluded 2015 Health Innovation Challenge in Lagos, I caught up with the Managing Director of Access Bank and Chairman of Nigeria Health Innovation Marketplace, Herbert Wigwe, to tell us more about the challenge. Take a look.
It's a coalition of private sector institutions. So it's a private sector-led initiative to come up with innovative ways of resolving health challenges out here in the country. What we've done this far is basically get a lot of innovative ideas. We started this about a year ago, and we came up with a reward at the time with about $1 million to support innovative ideas in health that will save and have significant impact in terms of the lives of children and women. We have had over 1,000 of those ideas, innovators. We've pruned down to 300, not because they're not all important, but what we're looking for is maximum impact. Several interesting ideas, ranging from using mobile telephony to reach out to resolve healthcare issues, to innovative ways of financing, etc., etc. Today, we have about 42 innovators coming out of a boot camp where we've basically skilled up and said, okay, these are the 42 that are extremely, extremely crucial. At the end of today's exercise, we would have come down to about 15. 15 innovators with innovative ideas that are ready to go, all right, and would have minimum impact in terms of life savings of 200,000.
Now, what informed the decision to begin this?
I think healthcare is largely ignored in Nigeria. You find that even for the most basic things, people have to travel. Malaria, for instance, is a greater killer than HIV/AIDS in Nigeria. It basically takes out about 300,000 lives in this country, or perhaps even a lot more. If you look at the impact it has on the workforce, on cost, etc. Now, that's just one of them. There's a terminology people now use called medical tourism, which, as far as I'm concerned, is an embarrassing term because it just shows that you've not been able to develop your healthcare system to support your people. All right. Now, so what we decided to do was let us create a private sector-led initiative where we start looking for innovative ways to help resolve some of the health challenges we face in our country, so that we can resolve them internally without spending a lot more money on international travels, international medical facilities, and developing those economies.
Now, when we talk innovation, are we talking strictly technology, ICT in that line? I mean, we have to take into consideration the fact that most of the areas that are actually in dire need of public health care or delivery are the rural areas where you have little or no infrastructure to support any form of technology.
We're referring to a broad range of things. Technology is important as well. Some of it are not technology-based. All right, so what we've done is by pruning it down to 15, you may find some technology-led, others that are not technology-led, etc. The most important thing is what is that idea that can spread very quickly and basically have significant impact. So it could be technology-based, some of them will be, some may not be.
What do you make of avenues like this, like the boot camp, where innovative ideas are being shared and discovered?
Quite frankly, I am excited at the whole process. Because I didn't know it was going to be this exciting. And if you've watched any snippets of what happened in the boot camp, you will see that we have very driven people and who have come up with very innovative things. A lot can be done to save our country. A lot can be done to save lives and improve the quality of life of our people. And a lot of it can be done internally, rather than going outside to seek for it.
Why do you think the private sector is shying away from the health sector in Nigeria?
It's not just in Nigeria. I'll tell you something. The more developmental an idea is, the less attractive it is generally for the private sector and for banks, for instance. That's just how life is. Because they're developmental and they are more social in terms of orientation. Okay, but the point is that if between the private and public sectors nobody's attending to those things, all right, your economy and your system does not grow. Not just in terms of GDP, but also in terms of the quality of lives of the people who live in that system. Now, so what we've done is to tell ourselves that we cannot keep shying away from this thing. We must all begin to address these issues because they have long-term impacts, not just on the economy, but on all of us who reside within this country. And that's what it is.
Do you envisage greater participation of the private sector in Nigeria's healthcare system anytime soon? I
think so. I think it's getting more and more exciting. First of all, if you look at the 42 innovative ideas that are going to spring up. Some of them will become more interesting over time in terms of the impact on the society, in terms of bankability, for instance. Okay, but you know, we are all Nigerians. We seek to live in our country. If for every little reason we have to travel, all right, to go and resolve health issues, I don't think anybody wants to live in that kind of environment, all right? And so one of the benefits of this whole thing and what is going to trigger the excitement is when other private sector institutions who are perhaps not part of the original team see what is happening and the impact it will have on our country, you will see a lot of interest come on.